webinar this morning. We're excited. We've got a great panel of speakers today to help us have a great fireside discussion. My name's Nate Murray. I'm one of the founders of Crossover Health. I'll be moderating the discussion today. I want to remind the attendees on the phone, if you've got questions along the way, please use the webinar tools, the Zoom tools to submit those questions. We'll try to incorporate those on the fly into the discussions to our panelists. With that, I'm going to begin by introducing our panelists. I'm going to remove the slides so we can see everyone's face a little bit better. But why don't we get started by just doing quick introductions. Maybe Stephanie, we start with you, then Stephen, then Samit, and then we'll finish up with Nimisha.
All right. Well, hi, everyone. My name is Stephanie Bacardi. I am a doctor of physical therapy and certified orthopedic manual therapist. I've been practicing about a decade, and over half of that was in the Occ health space, working primarily with workers' comp insured patients. Now I work for Crossover Health in the DFW area, primarily with clients who do kind of heavier lifting type of jobs. So it was a very seamless transition there. So I'm very passionate about trying to improve function and communication between kind of these two areas and getting patients back to work as quickly as possible.
Excellent. Thanks. Stephen.
Hi, I'm Stephen Ezejico. I'm Crossover's Chief Medical Officer. I've been with Crossover for just under 5 years. I'm a primary care internist by background, and prior to coming to Crossover, I was at the Department of Veterans Affairs.
Excellent. Samit.
Hi, everybody. I'm Samit Batra. I'm the new Medical Director of Occupational Medicine for Crossover. Before my time at Crossover, I was practicing as a Medical Director of Occupational Medicine for a couple of large health systems, taking care of the employees and making sure that they were safe out at work, and then also consulting and acting as a medical director for a number of corporations as well. And it's great to be here today.
Excellent. And Nimisha.
Hi, good day, everyone. So I'm Nimisha Kalia. I'm currently the Chief Medical Officer for GE. And I also hold a faculty appointment. I'm the Assistant Professor of Medicine at Johns Hopkins University. And most of my career has actually been in academia. So I came over to corporate about 4 years ago, but it's a pleasure to be here. Thank you.
Awesome. Well, we're gonna get started. I'll moderate, ask some questions along the way. As I said, this is a fireside discussion, so jump in, be irreverent, share your opinions. I think what makes this valuable is the perspectives that are shared. I think our attendees are curious. Some are curious about OCMED. Some are, deep, knowledgeable professionals in the world. And so I think as we share these perspectives, I think it'll be valuable for everyone. So, Samit, I'm gonna get the discussion started with, maybe you can help us understand, is what is occupational medicine? What is its value to employers?
Yeah, so occupational medicine is a clinical specialty that's really focused on the health of workers. And that comes into play both in the prevention of work-related injuries and illnesses, as well as the treatment and management of work-related injuries and illnesses. And from the employer's perspective, a lot of employers, especially larger employers, are self-insured for their workers' compensation programs, which means they're spending money directly on the medical care for injured workers, as well as the lost wages if somebody has to miss work. And so it makes a lot of sense for employers to want to prevent those injuries from happening in the first place. It's an incentive for them to have safer workplaces. And it's also an incentive for them to, provide a really high quality care to get people back to work faster. And so that's where our role as clinicians and experts who understand the workplace, who understand work-related hazards, and who are good at communicating with the employer can play a major role in smoothing that whole process.
Thanks. And Nimisha, similar question to you. I mean, you've worked for large institutions, employers, hospital systems, consulted. What do you think the value of an occupational medicine program to these institutions is?
I think it's a few different things. It's to help retain good talent. It's to help take care of that talent. And then to really retain that talent, look at the long-term sustainability of the entire institution. So talking about like ESG initiatives. And then, I think the other value is really dependent on the employer. Some employers might value looking at kind of the base level of what they're required to do, such as the compliance-based health surveillance programs or the workers' compensation programs, so work-related injuries and illnesses. And then other employers, the ones that have more experience or more sophisticated and experienced in this realm, might also start to look at the benefits space and say, okay, how else, what other benefits can we also offer employees, along with taking care of the basic requirements. But, you know, what other benefits can we look at? Gym memberships and other benefits that we can incorporate to help optimize their health. And then when you get even a step higher than that, then you start looking at employers that are looking at total worker health or holistic health, taking into account mental health, which is a big issue right now, and also incorporating some social determinants of health into the overall holistic health of the employees.
Thank you. Stephen, you're the Chief Medical Officer of Crossover. You know, we've largely been in the primary care space for a long time. That's been a core part of our vision. You know, what synergies exist between the value that Samit and Namisha just described related to occupational medicine and, you know, what has been a longtime emphasis of ours related to the value of primary care to these employers?
Yes, Nate, I think one of the big things that Namisha and Samit are talking about is that employees have a relationship with their company. And when the company is looking out for their health, they're looking out for their health in a holistic fashion. And that really actually fits very well with Crossover's approach to primary care, because we believe that the relationship between a member and their primary care provider should also be a relationship. And it should also be holistic, and it should be looking at all those factors that influence the health of that person. With occupational health, you're looking at it from the perspective of them in their employment space. But in primary care, you're looking at it from the perspective of their whole person, which includes their employment space. And so being able to look at not just the biology of disease, but also looking at those psychological, physical, and social factors that are going to impact their overall health and well-being is going to be positive, regardless of whether or not you start in the employer space or you start in the primary care space. The nice thing about having a relationship between occupational health and primary care is that occupational health is often the first place that people may encounter the healthcare system. And while things may be discovered that may have an impact on the person's health, they may not have a work impact, but they need to be addressed. And that relationship with occupational health and primary care allows for that handoff to make sure that those things are really being addressed and the person is not only being seen as a whole person, but is being treated as a whole person.
Gotcha. Thank you, Stephanie. You know, from your perspective, you've worked in the occupational health centers, treated a lot of patients. You know, there could be a narrative that sometimes employees are seeking these prolonged absences. They're seeking, you know, situations where they may not have to be at work. You know, what has been your experience in working with employees that are coming to you for an occupational injury? Is that the case? Has that been your experience?
Yeah, so this is a really important thing to kind of flush out, because there is in the private sector this really this big stigma around patients who might be coming into a clinic under workers' comp insurance, and even to the point where in the realm of differential diagnosis, it's classified as a yellow flag if you have someone with a work injury coming into your clinic. When I transitioned over to an Occ health clinic where that's all we were treating, I was very shocked, and maybe other people will be too, to find that that was not the case at all. Almost all the patients that I treated were desperately trying to get back to work. And in fact, if they were going to be lying to me about something, they were lying that they felt okay, and they wanted to get back to work faster, and they wanted me to release them, and I'd have to walk them back and say, no, we shouldn't be walking on that ankle. We need to, you know, you're not safe to do that. So there is a stigmatization around this area, and there is also a big tension between, I think, the employee and their perception of how much the employer cares about their health and getting better. So that kind of exists as well. So anything we can do to, you know, facilitate this process better, providers providing care, employees receiving treatment, and then getting back to work faster to help the employer will just be a win-win for everyone.
You know, it seems like, sorry, was somebody gonna say something?
No, I was just gonna say, I completely echo Stephanie's experience. Mine's been the same in terms of, there's some bad apples, but for the most part, people want to feel productive. They want to be at work. And so I couldn't agree with her more.
Yeah, it seems like just the way that you guys have described the value of occupational medicine, the primary care side, Stephen, that there is a lot of alignment. I mean, Samit and Namisha, you guys talked about the retention of employees from an occupational medicine perspective, keeping them healthy, keeping them productive, they're a valuable asset for the company to be able to perform whatever their commercial businesses are, right? Stephen, you talked about that the entry point may be occupational medicine, and there's a lot of synergies with keeping that employee healthy, whether it may be an injury, it may be whatever the case may be, but also relating that to, Namisha, you brought up mental health, right? And thinking about SDOH factors. So, from your perspective, and this is a question to everyone, there's probably lots of opinions about whether an occupational medicine program and a primary care program can coexist together. And I'll even say, can they coexist together in the same facility, maybe with different providers? Can they coexist from a single provider, maybe at a small site where a single provider is performing both the occupational medicine side and primary care responsibilities? So let me throw that question out to you guys about coexisting. What are some of the advantages, disadvantages, the ways that they could potentially coexist? Maybe there's some elements where they shouldn't coexist, and maybe what are those situations that should be managed for? So maybe we can start with Samit on this question.
Yeah, I think to, Namisha's point and Stephen's point, a lot of times when you're practicing occupational medicine, especially when you're not connected with primary care, you run into situations where you uncover something in that person's health history that they may not have known about. It could impact their ability to recover from an injury or even be cleared to do a certain job. And then you're kind of stuck because you don't have the ability to take on that person's care. I was doing a lot of DOT physicals at one point in my life, and a lot of folks would unfortunately be diagnosed with diabetes. They'd have sugar in their urine, very uncontrolled, but I couldn't do anything about it, and they didn't have a primary care doctor that I could even send them back to, and it was very, very frustrating. So I actually think that the synergy between occupational medicine and primary care enhances both. It enhances your ability to take care of that worker, get them hopefully cleared and able to do a job or get them back to work, and also keep them healthy in that job for much longer. And as we have an aging population and a kind of a long-term labor shortage, which we saw during COVID, but if you project out 10, 20, 30 years, it's only going to get worse. Those synergies become really important. There are some circumstances I would just say, to your point about single providers, single sites with OcMed and primary care, I think that's all very doable. But, and what we're taking the approach of at Crossover is to keep the data separate. Occupational health data will live in its own system. Primary care data will live in its own system to kind of, make sure that nothing that the employee doesn't want their employer to see, won't end up in the wrong place. And there will be times occasionally where a provider may say, I'm really not the best person to be managing this issue for you because of, I have a longstanding relationship with you and it's kind of contentious between you and your employer. In those situations, the provider can always take a step back. We can always make a referral if needed, but those are going to be the vast minority of cases. And I think in the vast majority of instances, it's going to be a really synergistic relationship that works well. But I'd love to hear what my colleagues on the panel think about that too.
And let me just load a little flavor on this before anyone else responds. I'd love to hear your opinion, Namisha. But what happens? A question came in. What happens when a person is hesitant on sharing personal health information with an occupational medicine provider? What's the response in that situation? Maybe Namisha?
This happens quite frequently. And it's, again, I think from a clinician's perspective, the answer to that is I'm trained in internal medicine and occupational medicine. So I've seen both sides, but in occupational medicine, we have a lot of employees that'll come in and say, I don't want to talk about anything else because I know the employer will have that information. And my role as a clinician is to say, my goal is still the same as when I was in primary care. My goal is to help you to get better. Now, the information that I relay to the employer is going to be, can you work and under what conditions? And that's really it. We are still gonna respect your health information, but as it relates to the job, there might be certain things that we do have to disclose. So kind of being very upfront with them with in terms of what the process is gonna look like. And that's, I think, what Sumit was also talking about. I think the importance of understanding the difference between primary care and occupational medicine. Primary care is really focused on getting to the underlying cause of why are they having this disease process? Let's get the diagnostics, and then let's look at the overall health picture, incorporating lifestyle factors into it, and help them to live optimally. Whereas occupational health is focused on the etiology or the mechanism of injury, really, and saying, was this a work-related injury or not? So we're focused on the mechanism of how it occurred. And then we're also looking at what resources in our company ecosystem do we have to help this employee get better. Sometimes it might involve safety, taking a look at the mechanism of injury warrants us taking a look at this particular department and saying there might be some safety issues going on. It might we might call HR or legal in, so our employer ecosystem. And then occupational health is also very well versed with the workers' comp process and what that looks like for the employee. So if you are able to do both together, I think you provide better care for the employee. And I think for me, it's always been, be transparent with the employee in terms of what you are able to share and what you're not able to share, so that they have that trust with you and they feel more open to sharing the information.
Do you find that you're able to establish trust as an occupational medicine provider with your members? Is trust something that comes up often? I mean, it seems like if you're upfront, as you described, that's just a method to build trust. And has that been effective for you in building trust with your patients?
Yeah, I think that's the foundation for me. Like I really tried to build a rapport with them. And again, my role is still an advocate for the employee. And it's not just that I've been doing that since I was in primary care, right? Like trust is really important. I think I try to relate to them that the more information I have about what's going on, the better I can help you, the more resources I can try to pull in and actually help whatever's going on in your life. And I the research also backs this up, right? Like if you take a look at employees that don't trust their employer and maybe go out and get an attorney, those claims that have attorney involvement are 390% more costly and result in longer time off work when there's an attorney involved. So if you don't have that foundational trust, I think that's when the whole system starts to collapse. So for me, it's always important. And I genuinely like learning about employees, learning about their interests, and also learning about like how we can help them together. So I think it's very, very important, foundational even.
Yeah, that's great. Stephanie or Stephen, anything to add there?
I think it can work very well. And I think that, what Sumit said is that for the vast majority of the cases, there is great alignment between what the worker wants, what the employer wants, and what the provider would want. In a very small number of cases, there may be a divergence there. And I think that's actually where, having the ability to have that be adjudicated or handled by a third party preserves the relationship between the employer, the worker, and the provider. And I think that's actually what leads to some of the, it leads to being able to maintain that trust and maintain that satisfaction. Because, it is a little bit different in primary care. In primary care, we are the primary advocate for the member. In occupational health, there is a dual responsibility both to the employer and to the worker. And so you want to make sure that those things remain, that people are aware of what those are, what the benefits, what the limitations of that are, but also have a mechanism to be able to address it when there's a perception of a divergence from the member's perspective of what's in their best interest. And I think by having those systems built in, it really allows the vast majority of cases to be handled in a very comprehensive manner within a shared primary care occupational health space.
Gotcha. What another area of important alignment and trust is, like, sometimes occupational medicine and, a primary care aren't managed by the same departments at the same company. Sometimes they might fold under a benefits department, both of them. Sometimes occupational medicine might fall under a safety department. Maybe Namisha, what's been your experience of having alignment there when they may not fall under the same department, and how do you, drive to the same goals, or at least have compatibility and good trust and alignment at the corporate level?
Yeah, I think it depends on kind of the importance of ensuring that you have safety, the clinical side, HR, legal, kind of all working together. It couldn't be understated. I think all of that's really important. Now, some employers formalize that and say all of you are going to report to the same department so that you are constant in constant communication. And even if that's not the case, even if you're reporting to different departments, I think it's really important to at least have dotted lines or very open lines of communication. So I've had a previous experience where at Johns Hopkins, we had the safety department, the clinical or all the workers' comp clinical side, as well as the workers' comp insurance side, adjudication side, all report to one department. That was really important because when we had root cause analysis that we had to do after a work-related injury, we could easily get a hold of safety and have them look into how to mitigate future incidences from occurring. And whether you have that formally, like in that role, or whether you have that informally in other roles that I've had, where you may not have, again, direct lines to the same department head, but you're at least in constant communication, because the goal is the same. Everybody wants, including the employee, would like to be back to work and productive, I think, as soon as possible, as safely as soon as possible. So the goals are aligned. It's just making sure that those open lines of communication are there.
Yeah, I think that's great. I think one thing that's important, especially when you're trying to align the goals, is thinking about the key measurements under the program. And so Samit, Namisha, Stephanie, you've had experiences. What are some of the key measurements that you're really driving towards? I mean, you're doing this at GE right now. What are the key indicators? And then how do you drive towards those key indicators?
Yeah, maybe I'll kick it off from more of the clinical OcMed perspective, but generally, like when you're a trained occupational health provider, you understand that the company cares about a few things. They care about OSHA recordables, which are sort of an indication of the severity of injury, and when the companies like to see that those rates are low or trending downwards for a variety of reasons that affect their bottom line, their reputation, sustainability scores, and other metrics. But also, just total injuries, lost work days. So, how many days are lost when an injury occurs, length of claim, the longer a claim is open, there's more cost from, income replacement, medical costs, potentially legal costs if it goes down that road. And so companies are monitoring all this. And what we are trained in as occupational health providers is that we have a big impact to play by seeing people early on, trying to get them back to work, focusing on, their functionality and what they can still be able to do at work, communicating with the employer proactively about, light duty and modified duty, and then really just trying to stay close on treatment, where and sometimes in the primary care world, you may see somebody every 3 months. In the OcMed world, you want to see people every week or two, right? Making sure they're making continuous progress, advancing them towards return to function and return to work. And then also obviously staying in contact with your teams, like your physical medicine providers and other colleagues that are working on the same patient. So those are metrics that we care about, that we know that employers care about.
Yeah, I'll add on just a little bit more. I think that was great. I think obviously we look at some key metrics such as the utilization. If we have an on-site, near-site clinic, we're looking at how many employees are actually utilizing it. That gives some proxy indicators of things such as satisfaction. Like employees have choices of where they go to as well, and depending on the state, for work-related injuries, for non-work-related injuries. But so if they're utilizing the on-site clinic, that's a very good sign that that they're getting the proper communication and that they're being given instructions that they can understand, that they agree with. So I think we look at that very closely. We obviously look at healthcare cost savings whether we're looking at major med, or if there's any changes to the pharmacy plan or any impact on the workers' comp program. So we do take a look at the hard numbers, but I'll tell you, a lot of the soft feedback that comes back from employees is just as important. On, I went to the clinic and they really helped me understand what the workers' comp process is going to be like. They told me it's going to take about 4 to 6 weeks for my shoulder to heal or my knee injury to feel better. Just setting realistic expectations and working with the employee and then also giving them resources of who they can contact in case things don't go exactly as planned. I think that's been really, really important for us as well.
You know, it's interesting, Namisha, the narrative I'm picking up from you is the importance of a great patient experience for these occupational health patients that are coming in. You know, Stephen, that's very synergistic with, you know, what we've always been trying to drive at Crossover in the primary care model. You know, what are some of the synergies that you're seeing with the occupational program, the measurements that they're talking about? You certainly built a clinical operating system dashboard here to kind of be able to manage our you know, clinics across the country. But, you know, what are the synergies you're seeing in terms of measurement based on what Samit and Namisha said?
Yes, I think, you know, you could really say that we're both looking at things in terms of the triple aim. So are we delivering a good patient or member experience, both in terms of access to care and the experience of the care when you go in there, and can we measure that? And then are we actually improving the health of the population? So in primary care, we're going to be looking at things like, are we doing prevention? Are we doing, how well are we managing chronic diseases? Whereas in, you know, in occupational health, maybe looking at things like injury rates or lost time rates. So really looking at the same thing that's really measuring the health of the population. And then the third part of the triple aim for employers is, are we actually doing it in a cost-effective manner? And so in primary care, you're often looking at, are we reducing the overall cost to take care of a population? Are we able to deliver deliver care in a more cost-effective manner? Whereas in occupational health, it's actually maybe measured in terms of wages or salary, or the cost to be able to keep that employer on the job, or having that employee off the job. So really, you're actually set up in ways that you're looking at similar things. You're just picking different metrics to measure those outcomes, which are most important to the population and most important to the client. And so in a setting where you had a combined primary care occupational health dashboard, the providers will be looking at both sets of that data, and you know, there may be overlap over things about how we address the patient experience, but you would also want to be making sure that how you're addressing the health, improving the health of the population is appropriate for the setting, whether or not that's the employer setting or you know, the general health setting, that you're really looking at that. Are we taking that full holistic view of what it means to keep somebody healthy, to have a good experience, and to do it in the most cost-effective way?
Great. You know, a question that came in, I think this would be interesting for Samit and Namisha. Namisha, especially you, given your experience in academia, there's a lack of experienced occupational medicine providers. Like, what's the job market like for them? What's the residency programs? Are you guys experiencing a shortage of trained occupational medicine providers that can serve the needs of employers in the country? What's been your experience in the growth of this specialty?
I can maybe start, and then
Yeah.
please feel.
Okay.
Yeah, there is a shortage of occupational medicine physicians. And I think the time that I realized it the most was during COVID, and how many companies really thought they had the safety, like I mentioned, like the foundational compliance and work-related injury portion that they were focused on, and they had their safety organizations basically manage that. And they were able to do just fine. When it came to COVID and really looking at the health of their employees and making sure that the safety protocols were in place so they could come to work safely and not cause vast outbreaks. That, and then also now looking at the mental health implications of COVID, the long COVID impacts that occurred during the pandemic. All of that has really put a spotlight on the specialty, I think, and that now I think more and more companies are realizing the importance of having a CMO or equivalent, even if it's a fractional part-time, at least advisor, so that they're getting this information. The residency program itself is typically 2 years. Again, I can't speak for all of them, but usually it's 2 years. Some of them are a little bit lengthened because they'll allow you to continue working as a clinician or working and then do it part-time. So, and usually it incorporates an MPH or a master's in public health degree within the training program itself. So it's
Gotcha.
part of the program.
I would agree with everything Namisha just said, but in general, I would even go beyond physicians. There's just not enough occupational health practitioners in general. Like we have nurses do quite a bit in the occupational health world as far as program management and making sure services like medical surveillance are carried out. And they can get a certification called COHN, Certified Occ Health Nurse, but there's just not enough of them either. There's physical therapists like Stephanie, who sometimes do specialized things in the work comp or OCMED world, and that's another certification you have to get. And unfortunately, I don't know if we just do a really bad job of marketing ourselves as a profession, but people like I fell into it after initially going into radiology. I think Namisha fell into it after going into internal medicine, and it's one of those fields that you kind of just have to serendipitously find out about or learn about. But it's very, I will say the flip side of that is it is very trainable. A lot of people, as long as they have a solid clinical foundation in whatever their field is, can be trained to do OCMED and occupational health. And so I think once people learn about the field and are willing to just invest a little time and effort in learning the nuances, they can do the job, especially when we're talking about the sort of clinical settings that Crossover Health operates in.
Yeah,
So I was going to say that they talk about primary care being a shortage, but there's about 209,000 primary care physicians in the US. There's 5,000 board certified occupational health providers in the US, just to kind of give you a comparison of the numbers. So even though I'm outnumbered on this call, that is not representative of how it is in the total United States.
I would just add, Nate, that I think one of the problems too is kind of the stigma around this population. And so I know a lot of like up and coming like physical therapists, this would not be their first choice to go into OC health. And so I think, addressing it at that level of really like making it a more attractive option for people to come by, there's a lot of red tape, a lot of things, documentation standards, which need to be there. But I think a lot of that keeps good practitioners away from like entering this field.
Gotcha. I think we need to put Samit, Namisha, Stephanie on the circuit out there and part of the recruiting team of the residency programs that are out there. And I think it'll bring a lot of energy to it. So, one of the things, maybe a stigma, I think Samit, you said this earlier, that occupational medicine tends to be on the more conservative side, to kind of debunk that. What are some of the innovations that you guys are seeing that are adding more value to occupational medicine programs? So maybe Namisha, we start with you on that.
Yeah, I mean, I think the innovation that I've seen more recently that I was really excited to see was the incorporation of wearables in a warehouse setting or in a factory setting. So that again, as occupational medicine, one of the first things you want to do is kind of determine the mechanism of injury. And so if you can have wearable devices like a vest or something that an employee can put on, and then be able to, have a machine that's helping the employee to giving a audible signal if they're bending improperly, or also letting management know like, hey, you may need to do more retraining in this department. It doesn't seem like people are following the proper protocols. I think that's hugely advantageous. Again, usually in the past, prior to wearables, we dependent on what the employee was telling us happened. And this way we can have some actual documentation of what's happening. And again, most importantly, be able to retrain them if that's what they need, and show them the proper lifting techniques or the proper bending techniques. So that's been really, really exciting for me to see the incorporation of wearables.
Samit, what are you experiencing?
Yeah, I would say that the wearables is probably the next frontier for us, even in the clinical setting. So being able to do an assessment of a new employee, understand where their level is at, what they have to do to be able to be successful in their job, and then using our partners like Stephanie in physical medicine to train them to get there, or to even guide their recovery after an injury to know that, okay, you, because of your back injury, can only lift 15 pounds comfortably, and we have objective data to prove that, and then kind of use that to create a guided recovery plan. I think that's going to be a game changer for us, because to be honest, we get good at it over time, but it is a little bit of a guesswork and an art more than a science at first. I also think that, OCMED, unfortunately, having a stigma of being a bit more conservative, we're sort of catching up to the things that I think general medicine has been doing for probably a decade now. So, utilizing more asynchronous communication between providers and employees, utilizing more telehealth and telemedicine, especially with the loosening of laws during COVID. And so even though we are a small field and there's a shortage of trained professionals, I think the scope of what we can do and the number of patients we can reach is growing. So I'm excited about kind of all of those things, hopefully, and pushing the envelope even further, into things like social determinants of health, mental health, things that Nimisha spoke about.
Those communication elements seem to align with some of the things that Nimisha talked about with helping the worker understand their journey of, what this process is going to look like. And so that seems to make a lot of sense. We like to keep these webinars short and tight, about 45 minutes. I want to hit some of the questions that I'm seeing come through. One of them, Nimisha, is for you. In your opinion, what separated high-performing vendors from others that you've worked with? So you're a decision maker, you're a chief medical officer at GE. What are you looking for in those that perform really well and those that, maybe wouldn't perform well for you or haven't performed well for you from your experience?
Yeah, usually when we're looking at vendors, it's a team-based approach. It's not just going to be me. It's going to be, my HR partners, finance and other partners that are going to be evaluating different programs. So they each have their own lens. So obviously we're going to be looking at the financials. We're going to be looking at the metrics that they're reporting that they had, like utilization is the other metrics that I mentioned. So looking at that, for me, from a clinical perspective, the questions that I would ask is going to be related to the patient experience, because I think that makes a big difference. And to me, it's a proxy indicator for how well the program or the system works overall. If the employees are getting constant communication, if they're also know, as you mentioned, what the process is going to look like, who do they contact if the process is not going as it should be, and then what are their options? If you want to be as transparent as possible and let them know what their options are at different points. So I think all of that's important. So those would be questions that I'd be asking about as well as what you referred to earlier. If a vendor is well aware of the importance of making sure all the different silos, especially within a large corporation or institution, are working together. And so those would be things that I'd certainly be looking for.
That's great. I'm going to put you on the spot again. We're entering this space officially with Samit. We've been doing occupational health medicine adjacent services, for the longest time. But now officially doing it, as a buyer, what are the areas that would, you would diligence more? What are the areas where you'd feel totally comfortable hiring a partner like a Crossover Health to do services for you?
I think Crossover certainly built a name for itself over time in terms of the quality of care that you deliver. And so that's something that I've heard feedback from employers and CMOs that have utilized Crossover. And then also employees have had a really nice experience in terms of the way the clinics are set up. They're very user friendly. And so that's really good feedback. And so I think obviously that'd be one thing that would give me a lot of confidence in saying, like, maybe we should be considering Crossover. Other things where when you're entering the occupational medicine space, I think there's a lot of challenges in this space, again, with the number of we have a dearth of qualified practitioners. And the quality of the practitioner actually makes a huge difference. Again, the literature supports this in terms of the cost and the overall quality of care. So one thing I would look at is, along with the workers' comp process and being able to talk through with an employee on how well you're doing there, what about things like mental health, or other specialists? Are you able to quickly and efficiently get them into seeing a provider that they need when they need it? Like an appointment 3 weeks out, 3 days out, 5 days out might not be what we actually need. What can you do utilizing technology that you may have that other vendors may not be able to?
Thanks. Maybe Stephen, for you, why did Crossover? You lead the medical group. Why did we decide to make this decision to go into this space, and maybe even a response to Nimisha on mental health and maybe some of the interdisciplinary functions of our care team?
Well, I think part of it was interest from employers, many of whom were either coming from the occupational health space or were in and realizing that they actually wanted primary care. They wanted to augment the occupational health offering, and also other clients or prospective clients who were in the primary care space but had an occupational health need that was either growing and wasn't really being serviced, or felt like was being serviced, in an incomplete fashion. And so when we looked at it, I think really what we looked at is like there is a lot of overlap between occupational health and primary care in terms of what people do, and that if you think of our whole model, which really looks at that holistic approach to care using a biopsychosocial model of care, where we bring together mental health, we bring together physical medicine, we bring together health coaching, along with primary care. Occupational health actually fits into that model because occupational health actually needs to use and take advantage of all the other people within our model as well. And so we really felt it was an opportunity where there'd be a lot of synergy between those two teams, and that really what you're doing is adding occupational health as another team member, another resource that allows our model to function in an even better fashion. And I think that really, if you're going to do care well, you want to be looking at individuals holistically, but you also want to be looking at populations holistically. If you're transactional and you're just treating a person as a collection of their diseases, or if you're just treating an injury as an isolated event, you're not going to see the trends or the issues that affect the overall health of that population. And I think having that approach is important, not just in primary care, but also in occupational health. And I think that's something that, we've really tried to stress and that we really emphasize with all our providers. And I think that, Samit and Namisha really echoed that as being something that's important in occupational health. And we really view that as something that fits well with what we do, and that we think we can extend into the occupational health realm because of those synergies and those compatibilities.
Awesome. Thank you. We really appreciate everybody's time on this panel. We appreciate the feedback. I want to share lastly that if there's follow-up questions, I have the contact information for Namisha and Samit, and feel free to reach out to them, email them, ask them those questions. We appreciate you guys for joining, for participating in this fireside chat. We hope we hit some of the key questions, many questions coming through, and hopefully we were able to intertwine those into this fireside chat. So Namisha, Stephanie, Stephen, Samit, thank you so much, and hope everyone has a great day. We'll see you. Bye-bye.
Bye-bye.